Hello and welcome. Today we're diving into a common yet often uncomfortable health issue: urinary tract infections, or UTIs. We'll explore what they are, what causes them, how they're diagnosed and treated, and most importantly, how you can prevent them.
So let's get started!
UTIs are primarily caused by bacteria entering the urinary tract. The most common culprit is Escherichia coli, often referred to as E. coli, which normally lives in the intestines. These bacteria can travel from the anus to the urethra, the tube that carries urine out of the body. Other bacteria, such as Klebsiella pneumoniae, Staphylococcus saprophyticus, and Enterococcus species, can also cause UTIs, although less frequently. In rare cases, fungal infections can lead to UTIs, especially in individuals with weakened immune systems. The pathophysiology of a UTI involves the ascending spread of microorganisms through the urinary tract. Bacteria colonize the periurethral area and ascend into the bladder. If the body's natural defenses fail to eliminate the bacteria, they multiply and cause inflammation of the bladder lining, known as cystitis. In more severe cases, the infection can ascend further up the urinary tract to the ureters and kidneys, leading to pyelonephritis. The inflammation and infection trigger various symptoms, such as frequent urination, burning sensation during urination, and abdominal pain. UTIs are incredibly common, especially among women. This is primarily due to their shorter urethra, which makes it easier for bacteria to reach the bladder. It's estimated that over 50% of women will experience at least one UTI in their lifetime. While UTIs are less frequent in men, they can occur, particularly in older men with prostate enlargement. Other factors that increase the risk of UTIs include sexual activity, urinary catheters, pregnancy, diabetes, and conditions that suppress the immune system. Age is a significant factor, with young sexually active women and elderly individuals being at higher risk. The symptoms of a UTI can vary depending on the severity and location of the infection. Common symptoms include a persistent urge to urinate, a burning sensation during urination, frequent urination in small amounts, cloudy or strong-smelling urine, and pelvic pain. In cases of pyelonephritis, symptoms may include fever, chills, back nausea, and vomiting. It's important to note that some individuals, particularly elderly individuals, may not exhibit the typical symptoms, and the infection may manifest as confusion or altered mental status. Diagnosing a UTI typically involves a urine test to detect the presence of bacteria, white blood cells, and red blood cells. A urine dipstick test can provide quick preliminary results, while a urine culture is performed to identify the specific type of bacteria causing the infection and determine its susceptibility to antibiotics. In some cases, imaging studies, such as ultrasound or CT scan, may be necessary to evaluate the kidneys and urinary tract, particularly if pyelonephritis is suspected or if there are recurrent UTIs. UTIs can be classified based on their location and severity. Cystitis refers to an infection of the bladder, while pyelonephritis refers to an infection of the kidneys. UTIs can also be classified as uncomplicated or complicated. Uncomplicated UTIs occur in healthy individuals with a normal urinary tract, while complicated UTIs occur in individuals with underlying conditions such as urinary tract abnormalities, kidney stones, or weakened immune systems. Recurrent UTIs are defined as 2 or more UTIs in 6 months or 3 or more UTIs in a year. The treatment for UTIs typically involves antibiotics to kill the bacteria causing the infection. The specific antibiotic prescribed will depend on the type of bacteria identified in the urine culture and its susceptibility to different antibiotics. Common antibiotics used to treat UTIs include nitrofurantoin, trimethoprim, sulfamethoxazole, and fluoroquinolones. Pain relievers, such as phenazopyridine, may be prescribed to relieve the burning sensation during urination. It's important to complete the entire course of antibiotics, even if symptoms improve, to ensure that the infection is completely eradicated. For severe UTIs or pyelonephritis, hospitalization and intravenous antibiotics may be necessary. Preventing UTIs involves several lifestyle modifications. These include drinking plenty of fluids to flush bacteria out of the urinary tract, urinating frequently and after sexual activity, wiping from front to back after using the toilet, and avoiding irritants such as scented feminine hygiene products. For women with recurrent UTIs, preventative measures may include cranberry juice or supplements, topical estrogen cream for postmenopausal women, and prophylactic antibiotics after sexual activity or on a daily basis. However, the use of prophylactic antibiotics should be carefully considered due to the risk of antibiotic resistance. The prognosis for UTIs is generally good with prompt diagnosis and treatment. Most uncomplicated UTIs resolve within a few days of starting antibiotics. However, untreated UTIs can lead to more serious complications such as pyelonephritis, kidney damage, and sepsis. Research is ongoing to develop new strategies for preventing and treating UTIs, including the use of vaccines and alternative therapies. Studies are also focusing on understanding the mechanisms by which bacteria cause UTIs and developing new antibiotics that are effective against resistant bacteria. The goal is to find more effective and safer ways to manage UTIs and reduce the burden of this common infection.